The Carina ventilator is a highly versatile compact ventilator specifically designed for use for non-invasive ventilation in a variety of subacute clinical settings. These might include accident and emergency, respiratory wards and high dependency units. High dependency care is an expanding service, and the use of non-invasive ventilation in acute hospital settings and at home has been steadily increasing.
So ventilation has now progressed over the last 10 years, and there's definitely marked evidence to suggest that when it's used appropriately, it can reduce the need for patients to be intubated and mechanically ventilated, and also a reduction in mortality.
Hello, Henry. How are you today? Okay.
The role of non-invasive ventilation is to deliver ventilatory support without the need for an invasive artificial airway. Such ventilation has a role to play in the management of many patients with acute or chronic respiratory failure. Non-invasive ventilation can eliminate the need for intubation or tracheostomy and preserves normal speech, swallowing and cough mechanisms. This results in improved patient comfort, a shorter duration of ventilator use, a reduction in hospital stay, and ultimately reduced costs.
Henry, to ensure we get the correct size mask for you, I'm just going to measure your face against my template here. Is that all right? Okay. I'm going to just take off the mask, put it to the side for a minute. I'll just place this on your face just to measure up. Okay, it looks like a medium. I'm going to take that off. I'm going to now place your new mask on. I'm just going to ask you to lean your head forward a bit. Okay, and back. Okay. And I'm just going to attach the straps to each side, and I'm going to tighten them. Okay, I'm going to attach you to the ventilator now.
With non-invasive ventilation, one of the most important parts is to actually have a good fitting mask, and the Novastar has a gel component which is technically very useful because it adapts to the patient's face, and most importantly, for these sort of techniques to work properly, it has to be comfortable for the patient.
The Novastar mask has a lot of advantages over our other masks that we use. You can quickly release the sides with a magnet. Both sides go off. Gel pads around the mouthpiece and the nose piece and on the forehead prevent pressure ulcers from forming around the face. It has a good fitting around your patient. An adjustable wheel here so that you can adjust your forehead pad according to the patient. So by doing that, you get an even distribution of pressure.
Chronic ventilator dependence has been defined as the use of mechanical ventilation for a minimum of 6 hours a day and for at least 21 days. Patients who benefit from this type of mechanical ventilation are those whose medical conditions would deteriorate were their ventilatory support to be removed.
It was really easy to change between modes. I was really surprised, and I found the alarm settings easily without any prompting and changed them so easy and straightforward. Really positive, you know, and easy to manoeuvre, and you can also attach it to the bed. Brilliant.
The Carina ventilator is a compact and versatile ventilator which can provide non-invasive and invasive ventilation for patients requiring subacute care and also for those needing longer-term ventilation.